The unfortunate reality in today's economy and today's healthcare that a lot of people think is regulated, but it's not, but that's another video, is that we'll drive 3 counties to find butter on sale for $3.99 a pound, but we won't question the price of a high-dollar procedure like a CT or MRI that can run up to $9,000. If you stick around and watch the rest of this video, I'm going to show you exactly how to do that. Here's a general case. You got a shopping list: milk, butter, meat, rice. You may go to 3 or 4 different locations to get each one at a discounted price, or if you're like me, you get low on fuel. I pull up my Gas Buddy. I have no affiliation with my Gas Buddy, and I did this for Mesquite, Nevada. There's a 9-mile difference. The lowest cost gas out there is $3.97. The highest is $4.85. I will drive 5 or 6 or 7 miles to save 88 cents on a gallon of gas. But you can do the same thing and save thousands of dollars by shopping for your health care. The cost of an MRI at the local hospitals around here runs between $4,000 to $7,800, $8,000, $9,000 in some cases, depending on what hospital you go to. But these are all independent imaging centers. I live in this area down here, so I'm likely going to go to Macon. It's $361, so I'm going to save somewhere between $3,700 and $7,500. That's a lot of money, and it's going to take me an hour and a half to get there. So, an hour and a half, $7,500. You figure, I don't know, $3,500 an hour. Savings. I don't have to pay taxes on savings, but I would have to pay taxes if I made that much money. Long story short, you go to the doctor. He sends an order for an MRI to a local hospital. Don't do that unless you're in the emergency room and you can't escape that profit center. Don't just go to a hospital for an MRI imaging of any kind, labs, and there's some other services. What you want to do is get the written order from the doctor that includes the procedure code and the description. Then you want to go to MDSave.com, and there's some other sites, or you can Google imaging centers near me. If you go to MDSave, enter the procedure code and your zip code. You'll get a map just like the one I just showed you that shows you the locations and the cost. You can schedule through that website, or you can call the facilities directly. You must tell them you are paying cash. If you tell them you're paying insurance, that cost is going right back up. That's how regulated the insurance industry is. Now, one thing you need to know is these costs will not apply to your deductible if you pay cash, because you've gone out of your little PPO network. That's another profit center. But personally, if you've got a $2,000 deductible and you've got a $5,000 MRI, you're going to pay the first $2,000, then you're going to pay 30% of the next $3,000, so that's $900. So you're going to pay $3,900 for that MRI that you could have gotten if you knew where to go for $361. I'm keeping my money in my pocket. Hands down, no question, that's the way I'm going to do it. And this is the way you can do it as well. These MRIs are a lot more expensive elsewhere than they are down here in South Georgia. There's a hospital in Pennsylvania charges $9,800 for it. You can get it down the road for $375. I just did that for a client. There are so many ways that you can save money on health care, but you've been conditioned to follow what I call unregulated insurance directions. Stay in their network, pay the high-dollar premiums, don't do anything that you're not told to do. You're trapped, you're caged. Hit the subscribe button, turn on notifications so you can learn how to save thousands and thousands of dollars on your health care. I've been doing this for 30 years. I've seen it from the PPO angle. I've worked for PPOs, for physicians, for hospitals, for insurance companies, and now for the past 22 years I have been saving money for corporate clients, and I mean huge dollar amounts. I know what I'm talking about. I'll give you the directions. I'll show you how to do the same thing for yourself. I'll see you on the next one. Have a great day.